Hello, everyone. Welcome to the NTI Pod Talk. My name is Dianne Kaler, and I'm the Director of Nutrition Therapy Institute. This Pod Talk is our opportunity to have fun conversations with interesting people who have interesting things to say about nutrition, food, and health. I talk to NTI instructors, students and grads, to health industry professionals, to farmers, and anyone else who has an interest in nutritional wellness. While many of our listeners come from within the NTI community as students and grads, we also have prospective students who tune in. And to those listeners in particular, I hope you find that the people we talk to inspire you to finally make the jump to pursue your passion and come to school here at NTI. So without further ado, let's get on with the show. Hello, everyone. Welcome back to another edition of the NTI Pod Talk. My name is Dianne Kaler. I'm the Director of Nutrition Therapy Institute, and I am here today with a special guest, Dr. Leland Stillman, who I am very happy was willing to come on our Pod Talk because I find him to be a very interesting medical doctor. So thank you so much for being here, Dr. Stillman. It's a real pleasure to have you on.
Thank you for having me. It's great to be here.
Yeah. So you are an internist by training, and then you went back and got additional training to become a functional doctor, integrative doctor. I don't know if you prefer one term over the other. I really look at you as more of an integrative doctor because of how you integrate all the different sort of aspects of health. Yeah.
Although I have to say I brand myself as functional because it dominates the Google search words.
Yeah, exactly. All right. So I very first learned about you because of your interest in light. And I've heard you talk about light and red light and UV light and the importance of light in health. And that's kind of my very first introduction to you. And then last fall, I saw that you were on the speaker list for the Weston Price Conference. And I was so excited because I was going to the conference and I knew that I wanted to go hear you speak. And then I was opened up to a whole new world and whole new appreciation of the things that you do and the things that you talk about. Your presentation at the Weston Price Conference was on iron and the iron paradox, but really everything you were talking about in your presentation really focused on nutrition and the importance of nutrition and the importance of nutrient balances.
Right.
I, as you were talking, I was like, yes. Oh my gosh, that makes so much sense. And the woman next to me was doing the same thing. We didn't know each other, but out loud, she's saying, yes. Oh, that's absolutely right. And come to turn out, she was a naturopathic doctor. And, I'm a nutrition therapist. I own a nutrition training school. And you were just really, spot on in complete alignment with everything I know and recognize about how nutrition impacts health. So
good.
It was such a pleasure to hear you speak there. So from there, of course, I went to your website, I bought your book, I watched videos on your website, I listened to other podcasts, and now I really I feel like I know you because I've heard you and watched you speak so many times, but it's still always interesting and always a good learning experience.
Good. I'm glad. And thank you for having me on.
So when I, see the things you write and watch your videos and listen to you, you truly are a holistic doctor. And I use that term very broadly to refer to whole body. And, you look at root causes through the lens of whole body, and you incorporate all of these really broad aspects about health. And, many functional doctors
don't do that.
Don't do that. They call themselves holistic, but they don't do that. They still sort of specialize in, they have their lane. They have
the peptide guy, or the testosterone guy, or the mold guy,
the leaky gut guy.
So when people ask me
or
why I'm
girl.
not a subspecialist, I say subspecialization is for people who are not ambitious enough to try to know everything, and that's not my problem.
There you go. And you succeed at
Well,
trying to know
I
everything.
cannot claim to know everything, but I certainly try.
Yeah,
Uh,
yeah,
it's a full-time job, but somebody's got to do it.
yeah. Well, and I look at even those functional doctors who, kind of talk about holistic health. I still consider them to be very much reductionist because they're
So
specializing in,
true. I know.
yeah. And like I really want to understand holistic, using that term, the way it is meant to be. So,
Mm.
but can you talk about your seemingly very conventional training and then
Mhm.
how you got interested in holistic and, we'll call it functional health?
Right. Well, I grew up in a family where we used both. We used conventional on the one hand, and then we used natural and integrative on the other. And so I got exposed to both. And then when my mother didn't get answers like she wanted from conventional doctors, she would go to other people of all stripes and varieties. So I remember being, taken around town to the chiropractor and, the Chinese medicine doctor who did cupping and coining, and felt like we tried everything when I was a kid.
Mm-hmm.
I thought a lot of it was really hokey and weird, and I didn't understand it because I was a child. And then as I got older, I thought there's got to be some value here, but I'm not really sure what the value is. And then my first mentor I actually had when I was a teenager, and he was a self-trained, self-taught naturopath who, in retrospect, was very kooky and off the rails. But at the time, his work was very fascinating to me, and I thought, oh, this is really interesting. And I took his advice to go to medical school over naturopathic school, and was miserable, hated medical school, and didn't like the paradigm at all, didn't feel like I fit in at all. And then I got out of medical school and did residency in internal medicine because I really didn't like pediatrics, and I really didn't like obstetrics and gynecology. And you have to do a little bit of that to be a family doctor. And I really liked sick adults because they were complicated. And I liked the puzzle and the complexity and the challenge of it. And I really think that, consenting adults are consenting adults, but kids are being so taken advantage of by the system today that it's really sick. And the pediatricians are really out to lunch as far as what really matters with children's health. And I'll just leave it at that. And then the obstetrician gynecologists have just totally over medicalized a very natural part of a woman's life, which is why I have a lot more fun talking to someone like Yolanda Norris Clark, who I saw speak at Anarchapulco last month in Mexico. Yeah. If you don't know who she is, she's really great. She's the only woman I've ever heard say or question really, like, why do we need any medical care in pregnancy? And I'm not an expert on this, but I love breaking bread with people who take that kind of a radical position and say, no, this has been totally over medicalized. We have to stop treating this like a disease and start just focusing on what do we actually need to do. Because if there's one thing I've learned in my practice and my study of medicine, it's that, someone will say, oh, well, if we don't do this, then this might happen. And then that might have a bad outcome. Right. And then you ask them and you say, well, hang on a minute. How many people do we have to not do that for one person to have a bad outcome? And this right. is where things get kind of sticky for people with things like vaccines, because what will happen is if you ask the people who are promoting vaccines, you say, well, how many people do you have to vaccinate in order to save one life? They have really, really bad answers. And it's embarrassing how high the numbers are. And that's just one example, right? The same thing could be said of, obstetrical ultrasounds or, prophylactic antibiotics in many cases, and so on and so forth. So that's how I got into what I do now, which is very outside the box, very minimalistic, but, minimalistic in the sense that I try to minimize the number of supplements, drugs, and things my patients are on, and focus on really getting them into the diet and lifestyle that allows them to be free of any of those needs.
Yeah. And so you are very much, I'm going to categorize you as a terrain guy. You Absolutely. Talk about the environment and how the environment that you create and the environment that you live in are what dictate your health. And, even in terms of getting infectious diseases and then having things linger from those infectious
Right.
diseases.
Right.
And then also, the getting or having chronic illnesses. And so the things that I've heard you talk about in terms of foundations within that environment are light, nutrition, exercise, breathing, mindset. I'm sure there are others, but those are the ones that kind of raise to the top of my awareness.
Yeah.
And as I said, I was first introduced to you because of my interest in light and really red light therapy. I like to talk more a little bit about light and what drew your attention to light and the importance of light for health and wellness, and why is it so important?
Yeah, I was working at a very high intensity, high price destination wellness center, and I saw a lot of treatment failure in young people. And I was very confused as to why young people would be failing the treatments, because we were using very high quality supplements, high quality, recommending these are people who are, eating very, very carefully. They're eliminating all the things they could possibly be allergic to. They're being very, very, very careful with their diet, their lifestyle, their environment, et cetera. And yet they're not getting better. And so I wanted to ask better questions. Why are these people not getting better? It's very frustrating. And you'll see this in the chronic mold, chronic Lyme world. People will say, yeah, I put away $100,000 at this clinic and I didn't get better. And that was upsetting to me. And so I ended up getting turned on to, and the other thing I found working there is that the people there, the patients there, they become, obsessive about their illness because it's that and get resolution, or the things they care about in life may not never happen. So they really learn and they really study and they really focus. And they're just a wealth of information because they also talk to one another. And so they create these networks of people who've been to all the clinics and all the different places and tried all the different things. So, I've talked to people who've gone to Germany for therapeutic hyperthermia, or they've gone to, the Paracelsus clinic in Switzerland, or they've gone to the Alpstein clinic in Switzerland. And obviously they do good work at these places. I don't want anyone to get the wrong idea. I love and would like to one day have a clinic like that myself. But I wanted to understand why people failed the treatment. And one of these patients turned me on to the work of a very eccentric, very, let's just say, abrasive neurosurgeon named Jack Cruz. And I read as much of his work as I could stand because he's written so much and it's very cryptic and difficult to stick with. But the ideas he presented there were very compelling as far as the importance of light with physiology and health and metabolism. And then I dug into the rest of the literature on this, a lot of which is very old. And it was very obvious to me that the light quality we were living under was a major component in why people were getting sick. That did not explain, or rather it did not explain, but it was compounded by biochemical problems that we have as a society. Fluoride in the water, or low intakes of minerals, or imbalances in minerals, or iron, additives in our food. And so people were missing this because it just wasn't something that they were ever taught was important. And to the human eye, visible light is visible light. There's a variation in the color scheme and how it hits the eye, but it's not like it's some big, your brain doesn't have or rather your brain protects you from the variations in light around you so that you don't struggle with them, by which I mean your pupil dilates and constricts. Your brain interprets color sort of like without you even thinking about it. And that leads people to not understand their light environment and its actual parameters. And then they get sick because they live in the wrong light environment. And then I started to wield light in my practice as a therapeutic, fixing people's circadian rhythms, getting them back out in nature, getting them under the sun, using red and infrared light, and people would just come alive. And then it was very, very clear that this was a huge missing piece of the puzzle.
Yeah, absolutely. I have been doing a consistent, for over a year, a consistent red light therapy practice, as well as, getting out first thing in the morning, walking without my glasses. And, at least 6 days, sometimes it ends up being 5, but really, I aim for 6 days a week.
I have little things like my red light at my desk, and I'll turn off. I get a little bit extra red.
Yeah.
most of my, I mean, as many of my calls as I can, I take out by the pool where there's abundant natural light.
Yeah.
Um, yeah.
Yeah, well, that's nice to live in Florida and be able to do that. Here in Colorado, the sun shines all the time. We have
I know.
lots of great sun, but it's cold outside. Like today, this morning I walked, it was 28 degrees. So, I still have to bundle up in a coat, but I'm getting the light in my eyes, and I think
Yeah.
that's beneficial. So,
Good.
yeah. Yeah, and I have definitely noticed changes in a lot of ways by using my daily red light therapy. So I'm committed to that. All right, so let's move to nutrition, because of course I'm a nutrition therapist. I own a school where we train nutrition therapists. So nutrition is like where I live in my head all the time.
Yeah.
So, and your nutrition guidelines completely resonate with me. They are in complete alignment with everything that I understand about nutrition and that we teach here at NTI. And I like how you talk about sort of the troubles that people can get themselves into when they do extreme diets, whether it's usually extreme exclusion diets, and they get into these troubles with nutrient imbalances, and oftentimes it's imbalances in minerals.
Yeah.
And I've heard you talk a lot, I've mentioned that you talked about iron at the Western Price Conference. I've heard you talk about potassium and magnesium. I've heard you talk about many minerals, but the things that I keep hearing over and over again are potassium, magnesium, iron. Can you kind of briefly talk about how these imbalances happen, and kind of like why do we need to understand what our nutrient balances are?
Absolutely. So, with nutrients, and the funny thing about the word nutrition is that when you actually look back at what it means, to nourish means to bring up in an appropriate or good way. And so I think that people get lost in thinking about nutrition, in just thinking about the matter. But this is why I like to relate things back to Einstein's famous equation of relativity, E equals mc squared, because energy and matter are interconvertible, and there's always two sides to that equation, and they have to balance. And so, the light you get on your skin, the word eat actually means to absorb and assimilate in a way. It's a very old word. So you could say that you eat light. It would not be an improper use of the word.
Mm-hmm.
And so it's funny. I think that people have been lost in the nutrition world as food, but I don't think you can really wield the matter part of the equation without understanding the energy. But anyway, so these nutrient interactions and imbalances are really interesting. In a state of nature where we have no choice but to eat a local seasonal diet that is naturally diverse and of a wide range of foods, it's basically impossible to create massive nutritional imbalances. By which I mean, if you go back and read a guy like Weston A. Price, these people he was studying were not like, well, this fish is a little like oily and it makes me feel weird. Like kids today will be like, I don't like that, I don't want to eat it. And then all of a sudden it's like, well, I'm never going to eat that food. And if you look at, like, Jeff Leach did this great study of the microbiome, or one of his lab assistants, I think it was, or students, did a stool collection study in the UK. They measured the microbiome. They sent him to the Hasda, a remote tribe in Central Africa, who are hunter-gatherers. They looked at his microbiome a couple of days later after eating the traditional Hasda diet for 3 days, and his microbiome is completely different, right? When they looked at the Hasda diet, it was something like 365 different foods, right? Mm-hmm. And it kind of depends on how you characterize that, right? Let's say that the Hasda eat porcupine. Well, are you going to characterize porcupine brain and porcupine liver and porcupine, flank steak and porcupine tenderloin all as different foods? Right. And it becomes very academic, but the point is simply that nutritional practitioners should look around and think, how many different foods are my patients eating? Because what's remarkable is that with modern breeding and agriculture and marketing, people have restricted their palates to 10, 20, 30, 40 different foods.
Yeah.
And they don't think about that. They just think, oh, well, I like oysters, or, oh, well, I like, salmon, or I like this. But what's interesting about it, when you look in these food groups, you see that across a food group of foods that might seem the same, they have radically different densities of different nutrients. So for whatever reason, mussels are really high in manganese. And I don't know why that is, but it is. Whereas oysters, which are also high in manganese, they're also very high in zinc. And so when you have massive inputs of one or a few foods, you'll get these big nutritional imbalances. And this is why I think native cultures understood one way or another that they needed to eat the whole animal. And partly that's driven by scarcity, right? If you only have one cow for the whole village, and it doesn't keep well because you don't have refrigeration, and it doesn't taste that good when you salt it or cure it or whatever as it does fresh, everybody eats the whole thing and you don't leave anything out. And that goes back to lots of little things that people have done over the years to do that, like combining organ meats with scrap cuts of meat in order to make sausage. So when you look at how the diet actually looks with its nutrient loads with a lot of different, variety, you see that the levels are normal and balanced. And that's where, restricting the diet and the palate becomes problematic. And when you look at the allergy literature, you'll see that the more of a certain food you eat, the more likely you are to become allergic to it. And the less you eat of it, the less likely you are to become allergic to it, and the more likely you are to tolerate it. That's not hard and fast, but certainly overwhelmingly the trend in Western society is that as we've overbred food and come to rely on only a few cultivars, and even then only a handful of different foods, food allergies have just skyrocketed. There's a lot of other factors in that. I'm not trying to just make it that simple, but one of the reasons why we look at traditional cultures who are eating their traditional diets and they don't have food allergy, they've never heard of it. The idea of a child dying from being exposed to a peanut is like the equivalent of science fiction.
Right.
The part of the reason is that they don't have this restrictive diet. They eat a lot of different things. What will happen, I think, is with people who get an allergy to a food, what will then happen is it will slowly degrade their system. It may not be something as bad as full-blown celiac disease, right? Which of course is taken off in terms of people's awareness of it and its prevalence as well. But it will slowly degrade their system and ruin their nutrition and reduce their ability to take in food. And that's why, so many people say, oh my gosh, I feel so much better when I stopped eating all the foods that I was relying on for as my staples and staffs of life. And I started eating more nutrient dense foods that are more wild and less overbred and, organic and whatever. And sometimes that alone is the secret to getting really great results with a case. And does that, and I hope that answers your question.
Yeah, no, it does. It definitely does. Yeah. I think the other problem that arises is that you have people who sort of recognize that food matters and food makes a difference in my health.
Yes.
And so those people are the ones who are usually doing sort of the extreme elimination type diets. And then you've got this entire other whole group of people who don't notice how food affects them, don't really have any understanding about food and health, but they rely on the information that is provided to them by the authorities.
Yes.
And you've got all this you've got all this corporate capture of the authorities. And so you have people, like just recently the Tufts Food Compass comes out, and you've got all these people saying that frosted mini wheats are a better choice than red meat, because red meat is toxic because it has saturated fat, and so it's sad. That's why it's called the SAD diet, the standard American diet. It's sad, but I think it's so common. And so you've got the people who are doing the high exclusion diets, and then you've got the people who are just eating like crap because they believe what they're told, and they believe the information that's provided on the front of the packages that says this is a health, it's just screaming on the front of the package.
Right.
this is a health food because it's, no fat, no cholesterol,
Right.
no. But then what is it?
I know. I
You
know.
know? So I think nutrient deficiencies and nutrient imbalances are rampant because of these varying influences on the food choices that people make.
Yes. And the other thing I think is really creating a lot of nutritional deficiency and imbalance is various forms of pollution. So the obvious one would be air, water, right? And not to mention the disgusting additives that get thrown into personal care products.
Mhm.
Recently had a case of a woman who she was diagnosed with a autoimmune skin disorder. And she told me she'd been putting aluminum based sunscreen on her skin for her entire life because the dermatologist, and get this, she lived in a place where it's not uncommon for the temperatures to drop below zero.
Mhm.
And she was told by the dermatologist, you got to wear this sunscreen every day. And I'm just like, really?
Mhm.
You got told to put sunscreen on in the upper Midwest,
Yeah.
December, where you're going to go from your zero UV light house to your zero UV light garage to your car, which is encased in glass, which blocks
Yeah.
all the UV light. And you're going to drive to your job and you're going to get out of your car and you're going to your fully encased, insulated, glassed in building, which will admit no UV light. Not that there's any in the environment at that latitude in January, December anyway.
Right.
But I mean, just the things my colleagues do and don't stop to think, well, do we need to wear sunscreen in December? It just blows my mind.
Yeah.
But anyway, she gets off this sunscreen and this autoimmune skin condition just completely goes away.
Yeah.
And so then I tell her, look, stop eating this and stop eating that because you might be allergic to it. And I don't know. And we can do a very expensive test, or you can just stop eating it.
Right.
And she stops eating it and she feels better. And now she's obsessed with what I do because she got such a good result with such a simple intervention that didn't have any downside.
Right.
Right. And it's really important that, and the other piece of that pollution that I want to also hone in on is the energetic side of things. I didn't realize this until recently, but it turns out that noise pollution, there's only one paper that I could find, but they found in this study that 4 hours of noise pollution at 100 decibels dropped, it increased your magnesium excretion by 100%. And so it is a massive overall reduction in magnesium levels in the system just from 4 hours of sound exposure.
Yeah.
So sound pollution can influence nutrient fluxes. And so people don't think about this, but it's very important to think about it. What are all the stresses that are coming into this person's life? The sound, the EMF, the air pollution, the water pollution. I mean, little things make sometimes a very big difference. My friend Jim is really a colleague at this point because we work together in my practice together. He likes to say that small hinges swing big doors. And that means sometimes a small change in your environment, whether it's just closing the shades at night or, getting 5 minutes of red light therapy or 10 minutes of sun in the morning, can make a really big difference in how you feel. And you don't know what is going to make that difference until you try it. So you just have to keep, trying those things and asking better questions. And that's probably the best thing I've learned to do is ask questions about everything of patients, because you'll just find the strangest things going on with them that they certainly didn't teach me how to ask really great questions in medical school. It was a process of, some luck with some great mentors and then just trial and error and just learning things. And I joke, it's always the last place you look as far as what's making the patient sick.
Yeah. Right.
And that means you just got to keep looking sometimes.
Yeah. Well, I just want to bring in one last thing.
Yeah.
You talk about mindset and how people's mindset has a huge influence on their health outcomes. So do you have like a particular way of telling your patients to incorporate things to change their mindset? So in other words, do you talk about mindfulness meditation? Are you more of a Joe Dispenza self-hypnosis kind of guy, or Louise Hay daily affirmations? Like, what kind of things do you talk about?
I like affirmations.
Yeah.
I like the meditations of a guy named Mantak Chia. I'm actually going to go study with him in April in Thailand. And what I've found, though, is most important for the practitioner to do is to figure out if the person's mindset is part of the problem. And no one talks about how to diagnose this. I mean, I guess the psychologists do, but I have to tell you, I find that the psychologists like to talk about theory, and they're really terrible at talking about practice. Maybe that's just my experience, or what ends up being on my YouTube channel or feed or whatever. But what I found very helpful over time was to I studied body language, because what someone's body language is doing will tell you about how they're feeling and how they're thinking and what's really going on under the hood, so to speak. And then the other thing that I learned to look for was the signs of abuse. And I think that people, when they hear the word abuse, they think, it's like husbands beating their wives, or parents beating their children, or sexual abuse, rape, things like that. But the reality is that there's plenty of that out there. But the vast majority of people who have problems with their mindset, or at least I think the vast majority of people, it's more benign abuse and neglect than that. And that's where reading work like Dr. Ramani Durvasula's work on narcissistic personality disorder has been very helpful for me, because now I know what to look for. And I'll be talking to somebody about, and they fixed their diet and they fixed their supplements, and they're taking the things I told them to take, and they're doing everything, and they're not getting results. And one of the things I'm always looking for is, well, is this in the picture? Did you at some point endure abuse, neglect, negative relationships? Have you healed from that? And I start to basically explore that by telling them stories about things I've seen, where I'll say things like, yeah, well, a lot of patients who get on the right supplements and maybe medications if needed, what they'll find is if they have had things happen to them they haven't really processed or healed from, or if they've disconnected from their emotions due to narcissistic abuse, is they won't respond clinically, because this other piece of them is not in balance. And I have a short list of reading on it, because I do think that patients need to do the reading, they need to do the work, they need to think about it, they need to chew on it, they need to spend some time being uncomfortable with their feelings. And the books I like on it to help patients to get to that place are Healing Light of the Tao by Mantak Chia, but that's more for the meditations and less for the mindset piece of it. I think Joe Dispenza's book, Breaking the Habit of Being Yourself, is very helpful. It really helps break it down so that people understand the process. And the process is not straightforward. It's a little bit confusing. A lot of it's counterintuitive, but it needs to be understood in order to be best actualized. Deadly Emotions by Don Colbert. He's an MD, and he's just one of those GPs who really has honed his craft to a very high level. And then The Great Pain Deception by Stephen Ray Ozanich. And then the classics in mind body medicine, things like John Sarno's Healing Back Pain. Those are really good books. I think that a lot of the mind body medicine guys miss the biochemical terrain environment piece of it. But then at the same time, all the people talking about biochemistry and terrain and EMF and whatever, a lot of them have absolutely no clue about this connection with relationships and mindset. And if they do, it's very cursory and not that helpful.
Yeah, absolutely. Thanks for those recommendations on those books. And I think I would add to that, kind of for general sort of easy reading, Bruce Lipton's, Biology of Belief. I think that's, a foundational book too. So anyway, well, I want to thank you so much for your time. One thing that I have heard you say more than 5 times, probably, quoting Hippocrates, the greatest medicine of all is teaching people not to need it. You definitely are doing that. And I've heard you say that is a goal of yours, is to empower people to not need you.
Practice.
And I think that's so incredibly powerful, and something that no other doctors would really, consider doing. Like, teaching people not to need me, that seems to be like a failing business model, but
it's a tough road to hoe, but it's the right thing to do.
Yeah, absolutely.
Because it is funny. I will have patients say, well, doc, I'm feeling so much better, and I don't know if I need to see you anymore. I'm like, oh, that's great.
Yeah.
Yeah.
Yeah. Yeah. Well, so I did not mention your book earlier. So if you can tell everyone your book, your
Yeah.
website, all of your social media
My book
handles.
is Dying to Be Free. It's
Yeah.
available at Amazon. And my website is stillmanmd.com. And yeah, I run a
Great.
practice that's pretty much all over.
Yeah. Great. Telemedicine, telehealth. I don't know what the right term is for that
Yes,
these
and
days.
technically we're splitting the practice into a medical practice over here and a coaching practice over here because most people don't really need us for labs and medicine. They need us for coaching,
Mhm.
whether or not they
Yeah.
realize it or not.
Yeah. Yeah. Well, I will just put in a plug. If you're ever looking for an excellent nutrition therapist, please reach out and let me know so we can post it on our graduate job board, because the graduates that come out of this school, I guarantee you are going to be the caliber you're looking for. So let us know.
Great. I'll let you know.
Yeah. All right. Well, thanks so much. It's been a real pleasure having you, and I have thoroughly enjoyed this conversation. So thank you.
I'm glad to hear it. It's good to see you. Thank you for having me.
Yeah. Hi there, and thanks for listening today. If what you heard today inspires you to want to pursue an education in holistic nutrition here at Nutrition Therapy Institute, please check us out on our website, ntischool.com, and reach out to us at admissions@ntischool.com. Our in-depth, comprehensive education is sure to provide you with the knowledge and skills you need to create the work of your dreams. Do something that feeds your passion, aligns with your values, and fuels your drive for a vital and meaningful life. It will be rewarding for yourself, your family, and anyone else with whom you interact. And with that, see you on the next episode.